Welcome everyone, and thank you for attending today's Healthcare IT News webinar, Cyberthreats, Ransomware, Malware. Is your healthcare organization prepared? Sponsored by Juniper Networks. My name is Mike Milliard, and I will act as moderator today. We look forward to your questions and comments, which you can submit at any time by accessing the question box on your screen. We'll make every effort to answer your questions during the presentation's live Q&A. During this webinar, you'll learn how to adapt your organization to be proactive against cyber threats, how to stop cyber attacks before they happen, and about resources that are available to protect your network. And so without further ado, I'd like to hand the presentation over to our first speaker, John Orby, Senior Director of Government, Education, and Medical at Juniper Networks. John?
Thank you, Mike, very much. And as the chart indicates, please, if you're going to the HIMSS conference in Orlando, please join us at booth 989. We'll actually be demonstrating the solutions that we're going to be talking regarding later in the presentation. So look forward to seeing you there. I'll be there myself. From an agenda standpoint, I'm just going to introduce our speakers and characterize our presentation. A couple of us are going to provide a current state of the environment in terms of what we see going on in healthcare regarding patient data, regarding security risk, so that we're on the same page in terms of what's going on and what organizations are watching and what things are being experienced by healthcare institutions. We'll then move to mitigating risk through a series of solutions that Juniper provides, and then we'll wrap up with a plan of attack and plan of action and questions and answers. There's a means for you to enter questions on the panel, and we'll look forward to answering those as we move forward. During the presentation today, in addition to myself, I'm based in St. Louis, Missouri. I lead our engagements with state and local government, education, and healthcare, the medical area. Joining me from Missouri, the middle of the state, Columbia, Judy Baker. Judy is an experienced healthcare executive, policymaker, consultant. She's actually teaches at Washington University and some other institutions, and is an advisor to us at Juniper so that we remain connected and understanding of the healthcare sector. Another gentleman joining me today is Tom Smith. Tom is an experienced healthcare exec, over 30 years as a chief information officer in 2 large health systems. Tom is up in the Chicago area, and I've actually known Tom for 15 or more years during engagements with he and his health system. And then I'm joined by a colleague out of Sunnyvale, California, a senior product manager over our security portfolio, Bapaya Palandra, and he'll review with us the detailed solutions that we offer. And again, they'll be demonstrated at the HIMSS 2017 conference in Orlando. So with that, I'm going to turn over to my colleague, Judy, to kind of frame up the environment in the current state. Judy?
Thank you so much, John, and good afternoon, and thank you for joining us. Our hope is that we're opening an ongoing conversation with you. And to get started, we wanted to talk a little bit about policy and kind of the landscape for healthcare cybersecurity. So first, we will discuss some of the policy frameworks driving user responses. To start we will talk about the National Institute of Standards and Technology Cybersecurity Framework, version 1.0, was started in 2014. And when it was published, 70% of those surveyed organizations saw it as the best practice for security, providing directions for companies and so on. And there's been ongoing versions. Primarily, the framework provides a common language and mechanisms for organizations to identify and prioritize opportunities for improving the management of risk and to foster communications among internal and external stakeholders. It's this standardization that will help to improve that. So these standards are being used now as a reference to support organizations in their emerging planning, and also now offering some certification processes that will offer some benefits later on. Secondly, the HHS, Health and Human Services Cybersecurity Task Force, formed just about a year ago, and has completed its 4 statutory meetings and will be issuing its report on recommendations early this spring. The report will include a plan to facilitate information sharing between the healthcare sector and the federal government in hopes of strengthening and standardizing health sector cybersecurity as best it can. So we are keeping an eye on that. And finally, as far as policy goes, the FDA has been very active in the recent past, particularly in the past 2 years, issuing guidance for the management of cybersecurity and medical devices. Warnings, information sharing, guidance for post-market medical devices is part of some of the things that it's issued. New healthcare payment models and alignments are creating cyber ecosystems with constantly changing needs and challenges. These alignments challenge governance and management to create and maintain a responsive security culture. And research has shown how difficult this is, especially in new threats like ransomware, just keeping governance and management aware and ready to react. And as many of you know, education and training must be ongoing. Managers must set good examples, and accountability must be a core value. Protecting patients with exceptional security must be as second nature in a healthcare organization as sanitary practices, and this is what's probably the biggest challenge. With these new alignments, the strategies must include the extended networking, such as the alignments with mobile devices, Internet of Things, firewall, software, and the cloud. An organization's governance and management will be increasingly accountable for the cybersecurity audits and reporting and the plans to deploy improvements. And those audits will continue to need to cover devices, digital services, ecosystem networks, and data storage partners. The next slide continues to talk about the landscape and expenditures and reforms. On the expenditures, healthcare sector continues to lag behind other sectors. ABI research states that hospitals, clinics, and insurers are under constant attack from malicious online agents, and yet the sector continues to lag far behind. They predict that by 2020, the healthcare industry is on track to only spend $10 billion globally. I know that sounds like a lot, but it is just under 10% of the total cybersecurity spend, and yet personal health information is 10 times more valuable than financial information even. So cybercrime in the healthcare sector is on the rise as healthcare data becomes more rich and precious. Healthcare data is more sought after really now than credit card data because medical records can't be reissued easily like credit cards can. Healthcare data fetches more money on the black market. Healthcare reforms have also been pushing for more care coordination and reaching across healthcare entities, driving vulnerabilities. And we've seen through the HIMSS cybersecurity survey that was recently conducted, some key findings have shown the angst that's out there regarding cybersecurity and healthcare sector. Just a few highlights of those findings are that the barriers to elevating cybersecurity were the lack of appropriate cybersecurity personnel and a lack of financial resources. And the most feared future threats included ransomware, advanced persistent threat attacks, and phishing attacks. These vulnerabilities are caused largely by email, mobile devices, Internet of Things, and the attempts of going after medical identity. So we wanted to talk in more detail about that, and my colleague Tom Smith will take us into talking about malware and ransomware and kind of the trends in that sector. Tom,
so on the next chart, which is complements of HIMSS analytics, just to characterize a little bit more empirically, we can see why people are concerned about security. This chart depicts the number of malicious hacking incidents over the past 6 years across hospitals in the U.S. These are intention breaches. The numbers, as you can see, rose exponentially in 2016, and really a rise in dedicated intended exploits. And this is why we're focused on securing patient data and the interest in obviously in this topic. The next slide really characterizes the kinds of breaches or type. And this depicts the number of volume of hospital patients whose personal data was hacked over the same period of time of the previous chart. In fact, more than 20 million Americans have had their patient information attacked. So let me move over to my colleague Tom Smith for further characterization.
Hi, this is Tom Smith. We selected these particular sites. As you can see, there's a varied number, various sizes, and so forth. All of us have seen reports in the press about ransomware. Unfortunately, these reports are not very extensive. There's little follow-up to talk about the impact. And I think that's just a fairly natural thing that most people really don't want to go into detail about what happened to their organization. They don't want to talk about the impacts on patient care and any kind of impact on a financial basis. We picked out these ones, these 6 or 7 here, only to show that it's spread around the country. It's actually spread overseas. Very many different types of sites are hit, small hospitals, big hospitals, some medical offices. And the type of attack and what people were asked to do to pay the ransom varied quite a bit. Of course, Bitcoin seemed to be the common thread throughout it, but there are other attempts to get cash in some form out of an organization. The slide we saw earlier that John discussed briefly were the big uptick in 2016. They went from 24 reported hackings or ransomware events in 2015 to 137 in 2016. Obviously, it shows that there's a large increase and that it's something that all of us in provider situations need to be concerned about. One of the things that's important is when you're talking among yourselves as an IT department or with management and the physicians, is to have some definition about what we're actually discussing. What is ransomware? An HHS fact sheet was published and gives a very general definition. They also admit in that same fact sheet that there's many variations on this type of malware. It usually does entail encrypting the data in some form or another until the ransom is paid. The obvious variations to this type of malware make it difficult to decide how to prevent it and how to convince management that your solution will solve at least part of the problem. I don't think anybody would claim it solves all of the problems, but at least you can be protected to the extent that the tools are available and can meet those needs. A little more detail about 3 or 4 particular sites. I think the second one, MedStar, was probably the one that got the most publicity. Maybe because it was in the Washington, D.C. area, I'm not sure. But in this case, the employees reported that they couldn't do simple tasks. The hospital shut down their email and their EHR, and they had actually diverted emergency cases to other hospitals. Not a lot of the news reports give us a lot of details, again, as I said before, but there are clear issues here besides the day-to-day operational issues. Clearly, there's a lot of manual work that needs to be done if you shut your systems down. Somebody's still got to run to the lab and get lab tests done, or the pharmacy. But other secondary issues come to what kind of confidence the public has in your organization, and what kind of trust issues you may have with your physicians, who are always somewhat skeptical of these kind of computer operations that we run. Finally, once you've obviously decided that there is a problem and you want to decide what to do, it's clear, I think, that even with the limited reporting that's available on the individual cases, it's a security and operational risk for any provider that each of you need to respond to in a risk management assessment. It's now also a reportable event underneath the HIPAA law, the rules. There is one thing that I would like to point out and give credit to HIMSS for doing. Judy mentioned that there were a lot of task forces and NIST publications, et cetera. And those are great in terms of providing an overall platform and structure. The HIMSS document that I mentioned here is it's a monthly online report. It's called the Healthcare Cybersecurity Environmental Scan. And again, it's published monthly on the HIMSS site. And it gives a lot of details about the things they're seeing lately, what types of malware or ransomware is available. And it goes into details so that it might say, for example, a particular device or a particular malware is now being distributed via fake Excel invoices. So it goes to that kind of detail about how people are seeing it and what they're doing in terms of trying to uncover where the source of the problem was. It also gives links to various types of resources to help people think through how they want to meet these needs and prepare to purchase software or train staff or whatever else needs to be done. Clearly, overall, the best type of action in this case is prevention. Reacting to it varies so greatly based on what actually is done to you that the best thing to talk about at this point is how to prevent it. And I'm going to turn it over now to one of our technical staff from Juniper, Pops, and he's going to go through some of the solutions that Juniper offers.
Yeah, thank you, Tom. Good morning, good afternoon, good evening, everybody. So I think, the previous speakers did a great job at kind of laying out the landscape for why we need solutions to address ransomware, right? So we got into a lot of detail as to, the kinds of problems ransomware introduces. But now the next few minutes, what I'd really like to do is talk about how do you actually prevent it. Tom's last bullet was the best way to deal with ransomware is to actually prevent it, and we're going to talk about how we do that. Now, before we get into the actual Juniper products that help here, I did want to kind of paint the larger picture as to what Juniper as a company is doing, Juniper Networks is doing in the space. And to that end, Juniper has a vision called Software-Defined Secure Networks, or SDSN. And essentially, it's a unified security platform where we bring in multiple pieces, including the detection component, which is really what we're going to be delving into a little deeper, but also the policy elements and also the enforcement points, right? So let me double click on that and kind of walk you through that overall framework before we kind of get into the detection piece. So what we're trying to do here is that we're saying that, typically the firewalls have always been the enforcement points within networks, right? And I'm sure that is pretty true in the enterprises that you guys manage and run. But given the fact that Juniper also sells switches and routers, we do have a network footprint that is unmatched by many pure-play security vendors, right? And so what we've tried to do with this SDSN framework is extend that capability not just to firewalls, but also the routers and switches, okay? So that's the basic underlying premise of what SDSN is. Now, there are three elements of SDSN. And the detection component is primarily powered by a product called Sky ATP, which is actually a key component in detecting threats of any kind, including ransomware, which is kind of the focus of today's discussion. The second element of this framework is a policy engine that we have built. And basically what we've tried to do here is say, policy, the previous management platforms that we had only managed firewalls, but this policy engine has the ability to also talk to, switches and also routers as well, right? And a couple of things that we've done in this space is we made the policy engine much more adaptive. We have made it able to handle things like natural language. So specifying a policy doesn't have to be an IP address or a port or things like that. It could be something a little more abstract, such as saying, prevent user A in department B from talking to user C in Department D, right? The department could be marketing, finance, and so on. So it's a higher level of abstraction that we believe makes policy application a lot easier. Finally, on the enforcement points, like I already alluded to, firewalls have always been the enforcement points of choice for a very good reason. But what we've tried to do here is say that, what if we could enforce or prevent threats closer to the endpoints themselves, right? So in this case, it might be switches, because typically you have an endpoint connected to an access switch, connected to a distribution switch, and so on. Or in later phases, we'll also be extending this to routers as well. And so that gives you complete enforcement across your network, not just on the firewalls. So this is the overarching vision that we have within the security group at Juniper, actually, quite frankly, for the company itself. And what I want to do over the next few slides is really talk about the detection piece, right? How is it going to help you actually detect and mitigate ransomware? So in order to understand this, I just thought I'd bring up a chart. Excuse me. Just advancing one slide here. Just give me a second. A chart. Now, if you look at this chart, what we have on the x-axis is simple threats to sophisticated threats, and what we have on the vertical axis or the y-axis is really a kind of a spread of opportunistic attacks to targeted attacks, right? And the point that this chart is trying to make is that, technologies that we've used in the past, including things like IPS, intrusion prevention systems, or antivirus and so on, they were all based on the simple premise that somebody in the world had seen the attack before, and so a signature existed for that attack, right? And what that really meant was, well, I develop a signature, I push that signature onto all my enforcement points, typically firewalls, like I already mentioned, and so then we kind of cross our fingers and hope that the enforcement point blocks that particular threat, right? And the kinds of threats that we saw were, plain viruses, right, which have been around forever, and then certain, different types of the same concept, right? And this could include things like polymorphic viruses, viruses that constantly mutate and make them a little difficult to detect. But quite frankly, a lot of the AV solutions had signature-based mechanisms that could even detect polymorphic viruses. Packing is another concept that you might hear a lot. Then things got a little more sophisticated, right? We began to see things like botnets. What you see, on the chart is CNC, command and control servers. So typically you download a threat, it reaches out to, a command and control server, which pushes further instructions and so on. And then you had things like fluxing, where DNS records are constantly changing and so on. And then we had this notion of persistent threats, right? So the threat, a good example, that kind of gained a lot of attention in the public domain might be Stuxnet, which kind of got into the network and then sat there and did a bunch of things, but nobody ever noticed it. And that's how the term persistent threats came about, right? The other interesting phenomenon that we've seen is that previously the threats were were not really motivated by financial kind of gains. Typically, you have some teenagers sitting in a basement cranking out code and trying to, just have fun and disrupt, in their words, fun, quote unquote fun, and kind of disrupt the network and so on. But these days, what we've noticed is that nation states have actually begun to sponsor such attacks, and therefore they have a lot of tools at their disposal, and the attacks become very targeted, not to mention also very sophisticated, right? And that kind of leads me to the northeast corner of this chart, which is saying that the threats that we see today, including ransomware. Now, ransomware, as people already pointed out earlier in the presentation, is also a threat. The only difference is that, once you get hacked, you have to pay up in Bitcoin or other means, and that's how the term ransom comes into play, right? But otherwise, it's a malicious attack, just like any other attack. And so the security gap that we have here in terms of these evasive, sophisticated, very targeted attacks cannot be met by the methods that we've used in the past, right? Like IPS and AV and so on, which are based on signatures. And therefore, we need a new way of looking at it. We need a new way to kind of detect and mitigate these threats. And the product that Juniper Networks has in this domain is called Sky ATP, right? Sky Advanced Threat Prevention. And the primary goal or the value proposition of Sky really is the ability to detect threats that pretty much nobody has seen before, Now, typically, threats are due to what we call zero-day vulnerabilities, right? Maybe there is a vulnerability in Java or Flash or some other application that nobody has ever realized or thought about, and then you have an attack that kind of targets that vulnerability. So that is what Sky ATP is all about, right? So hopefully that gives you an idea of what the original goals for Sky ATP were. So moving along here, kind of getting into a little more detail on what Sky ATP is, or what are the building blocks of Sky ATP, right? So there are really 4 building blocks of Sky ATP, right? And everything translates to increased efficacy, right? The first pillar is really cutting-edge analysis techniques, and I'll talk about this in a little more detail in the future slides. But really, we rely a lot on machine learning, sandboxing, deception, and behavioral analysis, right? So we have about 30 to 35 patents in this space. We have a team of highly skilled machine learning experts, because that is kind of the only way you can kind of scale up to these things. So cutting-edge analysis techniques and machine learning everywhere is a foundational element of Sky ATP. The second thing that I want to point out is, this is a cloud-based solution. So you would actually access the solution as a SaaS offering, or a subscription as a service. A software as a service. It's a subscription service. We do not have an on-prem version of the product, and the reason we did this is because we wanted to kind of leverage the power of the cloud, right? So to give you specific examples, the features that we can introduce on the cloud are orders of magnitude faster than how you might be able to introduce that same feature if you were to develop this on an on-premise appliance, right? The second thing is, many on-premise appliances are severely limited. Like if you have any experience with evaluating sandboxing related products, you might notice that the on-prem appliance would only support a certain operating system and so on. But the cloud gives us the power and the ability to kind of innovate very rapidly and kind of introduce features at a much higher speed, right? The second important thing about cloud is it's a global footprint, right? And what this really means is that if I detect a threat on customers A network, then the metadata from that threat is stored in the global database, and immediately the entire customer base of Juniper, of Sky ATP, can be protected, right? So there is no need to generate signatures, push it down to on-prem appliances, and so on. Operationally, there is a lot of overhead when you do something like that. And so it is a conscious decision by the team to go with the cloud kind of velocity, right? The fourth element is really shared threat intelligence. Now, regardless of what any vendor might tell you, there is no magic bullet, right? And what I mean by that is that in the security world, having the ability to consume threat intelligence from multiple sources and use that intelligence in an actionable manner is very important, right? And to that end, we do provide a rich API ecosystem around Sky ATP. And what that really means is that, let's say you as a customer have another, let's say a honeypot solution in your network, which, does it's there for a reason, but it might, generate some threat intelligence that you might want to incorporate into your advanced threat prevention solution, right? It could be something as simple as, hey, IP address or a URL with a certain threat level, right? That's the simplest form of threat intelligence. So we provide an API on this platform that allows you to ingest threat intelligence from multiple sources. For those of you who deal with these things on a daily basis and are security operators, you might have heard terms like STIX, TAXI, and so on. Today we offer a RESTful API, but moving forward, we do plan to offer additional means of consuming threat intelligence, and those methods could include things like STIX, TAXI, and other mechanisms as well, okay? So this is kind of a high-level picture of some of the key, the thought process that we had when we kind of set about to build the product. And just to give you a little bit of history here, Sky ATP has been around for more than a year now. We've added customers at a very rapid pace, and quite frankly, given the fact that we're based on machine learning, the more data that we learn from our customers and from different sources, we become more efficient, and also the efficacy of the system also improves. Okay. So moving along here, digging a little deeper, what exactly is Sky ATP and how does this actually work, right? And I thought I'd have, a couple of slides talking about that for those of you who, operate networks on a daily basis. So if you look at this picture, at the bottom of the picture, we have a customer, SRX. Now, SRX, as you probably know, are the series of firewalls. They're basically the product name for the firewall set that we sell, the next generation firewalls from Juniper. And, the zeros and ones that you see here are essentially traffic streams going from left to right. So think about the SRX being deployed on the campus edge, for example, campus edge firewall. You have users in that campus accessing the public internet, right? So that would be an example of HTTP and HTTPS. I do want to point out that it's not just plain text traffic. We do support what you might know, an SSL forward proxy functionality on the SRX, which means it gives us the ability to intercept streams, decrypt those streams, and re-encrypt those streams, right? So essentially, we can be a man in the middle. We can crack open the packet and also offer protection for HTTPS streams, right? And what does protection actually mean, right? And that's, if you look at the top half of the picture, we have the Juniper Cloud, and that's where Sky ATP runs, and that's where all the heavy lifting occurs, right? So we use a bunch of techniques, including but not limited to sandboxing. Sandboxing is, kind of popular in the industry. It's a term often used, so we certainly do that. And the basic idea here is that we have the ability to extract files and objects from these traffic streams and send them to the cloud for processing, right? And based on the processing that occurs in the cloud, we have the ability to kind of return a verdict back to the SRX, right? And the verdicts in this case are usually are on a scale of 1 to 10. 10 being the file is very malicious, and 1 being the file or the object is basically benign, right? So that's the basic idea. And of course, policies in the SRX will determine what you want to do. Depending on your security posture, what kind of posture you want to adopt. There are certain customers who say anything over a 6 I want to block or drop. Anything. There are other customers who might have a little more room, and they might say, well, anything above a 9 is something that I might want to block, and so on. Okay. The other thing, as you might imagine, is that if a user downloads a malicious file, once we process the file and we determine that it is malicious, we can actually do what we call inline blocking, right? So we have the ability to protect all the additional users in that enterprise from ever accessing that file again, right? And the reason is because the metadata is stored in the cloud, right? One other interesting concept here is Sky ATP, which this picture actually doesn't show, is that Sky ATP also gets a lot of threat feeds from multiple sources. Threat feeds might be basically CNC feeds or command and control feeds that are constantly pushed down to the SRX, right? So think about a user just reaching out to a known command and control server. We have the ability to block that right away at the IP level, right? And you can prevent any communication to certain command and control feeds as well. Okay, so this is kind of the the solution that we have. And of course, now the next question is, how do you manage all of this, and how do you kind of get visibility into what the product is doing? How do you kind of extract that information, right? To that end, we offer a web-based UI, which is again hosted from the cloud. And this is where you will be able to kind of monitor the product. We have a bunch of interesting or very useful dashboards, which give you a lot of contextual information. As you can see from the screenshot, this is just the landing page. We have a bunch of widgets that are customizable. You get information like top infected file categories, a top malware that we're seeing, what are the hosts within your network or the endpoints within your network that might be compromised, and so on. One thing that I do want to point out here is that this is really the monitoring piece of it, but the management piece of it and the config application and things like that are from another product called the Security Director, which is our primary management platform. And this feature is also integrated into that management platform, right? So if you have SRX firewalls and you have the Security Director as the management platform, then you would not even need to go to this web UI. But we do realize that many of our customers like to go only to the web UI and they deal with configuration in a different way, right? So we certainly accommodate that as well. So, now I want to talk about some of the foundational elements of the product itself, because I'm sure you're in the position to kind of evaluate products from different vendors and so on. So as I mentioned earlier, machine learning is at the heart of what we do, which means that we dig through massive piles of data, and we train the machine to basically recognize what is good data and then what is bad data. So what I mean by that is, so let's use Locky ransomware as an example, right? Many of you might be familiar with Locky. Of course, Sky ATP detected Locky. But if I look at that malware, essentially what it did is users got an email as a Word document. They clicked on the Word document, and the next thing you know, you're infected, right? So if I were to use machine learning, the machine learning framework on how Sky ATP might be able to detect that, we would actually extract features from the Word document, right? So we would have processed millions of Word documents, similar Word documents, and we might say things like, hey, if a Word document has macros enabled, it probably is bad, because in about 85% of the cases when I processed a Word document with macros enabled, it was bad, right? So this is really artificial intelligence. Some of you with a computer science background might be able to appreciate that and might be able to kind of know what I'm talking about. Just to use another example, if the executable is doing things like allocating large chunks of memory, sleeping for long periods of time, and so on, these might be considered abnormal behaviors and so on, right? So the machine basically learns to distinguish between good and bad. And like I always say, data is almost like new moat, right? And what I mean by that is the many systems that are based on machine learning become better the more and more data they have, right? And so if you look at this picture here, once the machine has learned what the good features are and what the bad features are, you input an unknown file, in which, in this case, it might be the Locky Word document, and it's able to deliver a verdict, right? So that's the basis of machine learning, and this is what we do with the product. A couple of other foundational elements that I want to quickly cover with Sky ATP is deception and provocation, right? This is also fundamental to what we do. Deception is basically, the idea of deception is that you emulate a realistic user environment. So let's say you are a user on Windows 7, you downloaded a file, that file is sent up to Sky ATP. Now, as you know, in sandboxing, what we would do is we would spin up an instance of Windows 7 as a virtual machine, and we would actually open that file, right, in a controlled or an environment, and that's why it's called a sandbox. It's almost like a detonation chamber, if you will, right? Now, what you do within that detonation chamber is what the slide is talking about, right? So we want to convince the malware that it is on a real system, right? So you might do things like, keyboard clicks and, using a mic, things like that, or forcing the malware to expose itself. So essentially, it's almost like a honeypot, right? So that's also kind of what we do here. And of course, we have the ability to look at over 300 different malware behaviors. Like I mentioned earlier, we have about 30 to 35 patents in this space, especially in the deception area, right? And we already talked about this. Deception is really the ability to simulate a real environment, and here are a few examples, right? The other thing that we do is also, and again, these are additional examples of deception, right? So, for example, during the tax season, you might see that, certain pattern images where people actually look for stored credentials and things like that. So we constantly adapt the system to kind of do these things. Provocation is a little different. Provocation is where you kind of force the malware to expose itself. And what I mean by that is you might actively interfere with malware operations. You might interfere with network communications and so on. And a lot of the ransomware that we've seen, ransomware that we've processed, actually, this works really well, right? Of course, the malware writers are also trying to do things to kind of get around these detection mechanisms, but, we're constantly improving the system. So two key elements to take away: deception and provocation. Deception is trying to convince the malware that it is on a valid system, and provocation is really doing things like bouncing the network connection, for example, and forcing the malware to reveal itself, right? So proof is in the pudding, right? So the thing is, what kind of threats have we prevented here? Now, like I said, we've been around for more than almost about a year and a half now. the product, works in conjunction with the SRX firewalls, as I pointed out. And we have detected a number of different threats over this time, right? Many of them are obviously ransomware as well. Locky is a great example. One other thing that I want to point out here, and this came up, one of the earlier speakers alluded to it, is, a lot of the malware actually comes in not by HTTP or HTTPS. Those are what we call drive-by downloads, but it's also over email, right? So we will be supporting email as a threat vector very soon, in a couple of months, both SMTP as well as IMAP as well. So, you will have the ability to scan malicious attachments and give you the ability to detect malware when that happens, right? So quickly running through some of the threats that Sky ATP has prevented, Locky, which we already talked about, right? And Locky, if you guys are familiar with it, it uses, Visual Basic macros to download the payload. And essentially what it does is it encrypts your disk with keys that are obtained through that CNC server communication channel. And once you encrypt the disk, you're basically hosed at that point, right? Because you're not going to get the decryption keys. And in fact, I have had cases where customers might actually reach out to the FBI and ask for what can we do here? And typically the answer is, well, just pay the ransom, because there is no way to decrypt your disk, which has been completely encrypted. Now, how do you actually prevent this? Of course, you need solutions such as Sky ATP, but, I talk to a lot of healthcare customers, and many of them actually have multiple, copies of their data, right? That is actually a very simple kind of a mechanism that you might use to give you some additional protection against these kinds of attacks, right? So just, if it's an exchange data, for example, just back up all your data, have multiple backups. Not saying that the backups also couldn't get corrupted, but, that's one way to do it. Other things that we've seen, Zepto, which is actually a Locky variant, basically renames files with the .zepto extension, but otherwise it's very similar to Locky. Covters is another one. This is what we call almost fileless malware. What it does is it uses obfuscated JavaScript. Obfuscation really means that you write the code in such a manner that it's very difficult to read, right? So that's kind of the basic idea. So use obfuscated JavaScript and garbage batch files. And again, the list is endless, but I think the point of the slide was really to say that, we have the experience, we have the technical expertise and a product to be able to deal with all these different kinds of malwares. And finally, one last example, Petya, Mishra, they're basically two variants, do the same thing. They not only encrypt files, but they also install themselves to the master boot record, which, as you can imagine, can be very, very disruptive, right? So hopefully this gave you a pretty good idea of what Juniper is doing in this space, right? And we talked about Sky ATP. Just a quick recap, we talked about SDSN, which is the framework. We talked about Sky ATP, which is the detection piece of it. We talked about some of the building blocks of Sky ATP, which includes machine learning, deception, and provocation, all very advanced techniques. And also, we kind of highlighted the point that it works in conjunction with the SRX series of firewalls. So if you are in the process, if you already have an SRX series of firewalls, you can certainly kind of milk that asset a little more by turning on these advanced features. Or if you're in the market for an SRX series firewall, you can certainly, and ATP is high on your list, as I assume it must be because you're in the healthcare industry, then certainly look at this as well. And one last thing that I want to point out is that we do have a free version of the product as well. Basically, any SRX series of firewalls can access a limited version of Sky ATP. Gives you the ability to process only executables. The premium version is obviously how we monetize it, and that is the full version of the product. So that's all I have. Hopefully it gave you a good idea. With that, I'm going to hand it back to John, I guess.
Thank you, Bob. Very good review of the architecture and the solution that we believe is material and meaningful to the healthcare sector. Obviously, earlier, Judy did a great job of characterizing a lot of the organizations, Health and Human Services and other entities that are providing governance and guidance around policy and what we should be looking at and working on. I provided some empirical information from HIMSS to characterize the environment, and certainly Tom went into further specifically to ransomware and malware situations that have occurred largely in the U.S., but of course not limited to the U.S., and actual incidents where ransom has been paid by a couple of institutions in the situation. At this point, we'd like to answer some questions. There are some that came through, and I'll hand over to Mike, who'll read the questions. And we expected that the questions are largely going to be around the solution area from what Bob's reviewed. So, Mike, over to you to go through some of those questions.
All right, terrific. Thanks to you all for a really informative presentation, and we do already have a bunch of questions. We definitely encourage you to add your own, please, as we go through this. But I will just start asking and toss them out to any or all of you to answer as you see fit. First up, for machine learning, how long does the Sky ATP need to train to reduce the amount of false positives? And how would this learning period affect or delay the ability to identify genuine threats or otherwise affect customers?
Sure. So this is Bob Subopaya. I can take that. So that's a great question. One thing I would point out is prior to even releasing the product Sky ATP, we actually spent a lot of time in training the machine, right? So we reached out to, the different sources of data in order to kind of train the machine, and only when we believed that it has an efficacy high enough to be a viable solution for our customers did we actually come out with a product. Having said that, like I pointed out during my presentation, the more and more we learn, the machine does become better. It's just the nature of machine learning. But at this point, we believe, our efficacy is pretty high. In fact, we will be entering into some third-party testing. There is an organization called NSS that some of you might be familiar with, which kind of tests products from different vendors. And so once those results are out, we will be able to share those. And efficacy is actually one of the elements of their test. But long story short, we've trained the machine long enough prior to even releasing the product for it to be effective. But point taken, yeah.
Another question, if the customer is hosting all their health informatics services in the cloud via a third-party vendor, does ATP still have a role on the customer side?
I'm just trying to understand that question. The customer is hosting all their on the cloud. Yeah, so the thing is the cloud, Juniper is responsible for the solution as a whole, right? So even though we use the cloud in order to store the data, process the data, and so on, we are still the ones offering the solution. And so the customer really deals with Juniper and not with whoever the cloud provider might be, right? And one thing I do want to point out here, given that there is in the healthcare industry, there is a lot of concern around privacy and regulations and so on, we actually destroy all the data immediately after processing, specifically things like MS Office files, PDF files, and so on. The only data that we do retain are executables, and we only do that for further analysis, right? And even the executables are actually destroyed after 30 days. So I think the question was alluding to those kinds of concerns, and I just wanted to kind of point that out.
Bob, this is Tom Smith. I think maybe the question was, if you don't host any data equipment or storage on your own site, but you rely completely for your provider's processing in the cloud or offsite, how would ATP be used in that case? So if I have all my email stored at Apple or someplace else, or IBM, and if I also have my EMR data there,
yeah,
how would ATP work then?
Okay, now I get it. Yeah, so a couple of things I would say here, right? So today ATP is primarily designed to protect campuses, meaning users accessing the internet and so on. So that's why we process HTTPS streams. With respect to email, as long as the email is coming in through your firewall, we do have the ability to protect it. But later on this year, we will also have the ability to integrate with third parties, right? Just to use an example, let's say you're using Office 365 for your email and so on. We do have, we are going to introduce the capabilities to actually access that data, right, directly, and be able to offer protection for that data as well. Now, EMR records, use the example, depending on where they're stored and so on, we might have to look into how ATP might be able to offer protection. We haven't really evaluated that. Yeah, but for email, we will have a solution.
Okay. Next up, to use Sky ATP properly, should a proxy server be deployed in front of the enterprise system, for example, an EHR on the customer side?
Not necessarily. We actually see both architectures. One thing that I would point out is if you have a proxy server deployed, Sky ATP would still work. All Sky ATP really does is it establishes a secure connection, a TLS connection from the SRX to the cloud. Now, if there's a proxy in between, depending on how that proxy is configured, you might need to, open up some pinholes and things. But it uses only the standard ports, which typically all the proxies will pass through. So we've seen both architectures, and we support both those. Yeah.
Another question. So the VPN is behind a firewall. Does that mean the VPN connection is safe? And can Juniper Firewall prevent or eliminate man-in-the-middle attacks using VPN connection?
A VPN is behind the firewall. Yes. Yes.
All right.
Yeah, I think the question was, can it prevent attacks, right? Yes.
Another question, with regard to data backup as a proactive prevention to, Locky, HIPAA has already mandated that all providers do disaster recovery backup. So having another copy of the data set should not be an issue. That's part of regulation compliance. Do you agree with that?
Yeah, I think I think that may be true, and we should just let that comment stand. Yeah.
And, if someone else is wondering, what notifications are required to be given in the event of a cyber attack?
Judy, this is Tom Smith. Maybe Judy and I could take this. When you have any kind of computer outage, you have to decide whether or not you're going to talk to the public about it, tell the press, et cetera. Most people just put a sign up at the station if you're going into admitting or to the doctor's office that says, we're having a computer problem. Not many people would announce the fact that they had a ransomware attack. But if there is a breach, if you decide after all of it that there is a breach, HHS and Office of Civil Rights has decided that you have a breach if you can't prove that there was a very low probability that the data was accessed by someone else. So if there is a breach and you have to report it, then you get into the issue of telling the patients that perhaps were affected, and then maybe offering some kind of a credit insurance or protection. And most importantly, you have to report to OCR that you had a breach, and you go up on their wall to tell people that you've had a breach, that outside people can go to the OCR site and see your name and what happened. So I think the reporting follows really the HIPAA breach issues.
Very good.
This is Judy. I would say that's right on target. And there's lots of resources, of course, on the government websites. For instance, there's a ransomware fact sheet that specifically spells out their most current thinking on when to report a ransomware attack.
All right. Well, we are just about at the top of the hour, so I just want to thank our presenters once again for a really great presentation. And thanks, of course, to the audience and all of you who submitted questions. But we hope that you found this event educational. And just a reminder to please be sure to complete the evaluation that will be popping up on your screen. Share your thoughts with us. So I'd like to thank everyone once again for taking the time to share their expertise with us. And a reminder that today's session will be available on demand until May 9th. So thanks once again, and have a great day.